This chapter has two main goals. The first goal is to help you understand the two basic electrical activities of heart muscle cells. These are depolarization and repolarization. The second goal is to introduce the basic components of the ECG. These components are waves, segments, and intervals. They form the foundation of ECG interpretation. Let us begin with the most important concept. A normal heart muscle cell at rest is electrically polarized. What does electrically polarized mean? The outside of the cell is positively charged. The inside of the cell is negatively charged. This creates a voltage difference of approximately minus 90 millivolts. So remember this clearly. A resting heart cell is not inactive. It is electrically charged. When a heart muscle cell receives a stimulus, depolarization begins. At the site of stimulation, the outside of the cell becomes negative. The inside of the cell becomes positive. This reverses the normal polarity. Because one part of the cell is depolarized while the rest is still polarized, an electrical current is produced. This current spreads along the cell. This spreading of electrical activity is called depolarization. When the entire cell becomes depolarized, the outside is negative. The inside is positive. At this stage, there is no voltage difference. Therefore, no electrical current flows. This is very important to remember. ECG deflections appear only when electrical activity is spreading. No deflection appears when the cell is fully depolarized. After depolarization, the cell must return to its resting state. This process is called repolarization. During repolarization, the outside of the cell becomes positive again. The inside of the cell becomes negative again. Repolarization also spreads across the cell. In individual heart muscle cells, depolarization and repolarization move in the same direction. However, in the whole heart, the directions are different. Depolarization spreads from the endocardium to the epicardium. Repolarization spreads from the epicardium to the endocardium. This difference explains many normal ECG wave patterns. Now let us connect this electrical activity to the ECG. On the ECG, atrial depolarization appears as the P wave. Ventricular depolarization appears as the QRS complex. Ventricular repolarization appears as the ST segment, the T wave, and sometimes the U wave. Atrial repolarization is usually not visible. It is small and hidden within the QRS complex. There are 5 basic ECG waveforms. They are the P wave, the QRS complex, the ST segment, the T wave, the U wave. The P wave represents atrial depolarization. This electrical activity leads to atrial contraction. The PR interval is measured from the start of the P wave to the start of the QRS complex. It represents 3 things: atrial depolarization, delay at the AV node, conduction of the impulse to the ventricles. The QRS complex represents ventricular depolarization. It is called a complex because it may contain 3 components: a Q wave, an R wave, an S wave. The ST segment begins at the end of the QRS complex. It represents the period when the ventricles are fully depolarized. Because no electrical activity is spreading, the ST segment is normally flat. Clinically, ST elevation suggests myocardial injury. ST depression suggests myocardial ischemia. The T wave represents ventricular repolarization. The U wave, when present, appears after the T wave. It represents the final phase of ventricular repolarization. Now let us understand segments and intervals. A segment is a flat portion between 2 waves. It does not include any waveform. The main ECG segments are the PR segment, which represents AV nodal conduction. The SD segment, which represents fully depolarized ventricles. The TP segment, which represents electrical rest and the true baseline. An interval includes 1 or more waves along with a segment. Intervals are used to measure time. Important ECG intervals include the PR interval, which represents atrial to ventricular conduction. The QRS duration, which represents ventricular depolarization time. The QT interval, which represents total ventricular electrical activity. The RR interval, which represents one complete cardiac cycle. Heart rate is calculated using this formula. Heart rate equals 60 divided by the RR interval, measured in seconds. The RR interval is preferred for heart rate calculation. This is because P waves may be absent or irregular in arrhythmias. Finally, let us understand ECG paper. The horizontal axis represents time. One small box equals 0.04 seconds. One large box equals 0.20 seconds. The vertical axis represents voltage. 10 millimeters equals 1 millivolt. The ECG machine is standardized so that the paper speed is 25 millimeters per second. 1 millivolt produces a 10 millimeter deflection. This standardization allows ECG recordings to be compared anywhere in the world.